Good afternoon. Welcome to the Children's Caucus. The briefing for today, we're going to talk about improved maternal and infant health outcomes through safe and stable housing. And particularly, we're going to talk about the Healthy Beginnings at Home program. Safe and stable housing is essential to healthy, thriving families. Ohio, like many states, is experiencing a housing crisis that had only been exacerbated by the COVID-19 pandemic. Housing has become expensive and hard to find, an unfortunate reality that leaves thousands of pregnant women and their children without adequate housing. When it comes to the pregnant population, homelessness is associated with poor birth outcomes, such as low birth weight and preterm. These can harm the overall health of a newborn baby. Researchers show that women who make use of homeless shelters are more than twice as likely as those who do not to undergo a complication that affects their health during birth. In 2018, Healthy Beginnings at Home was launched as a pilot program sponsored by CelebrateOne, the Homeless Families Foundation, the Columbus Metropolitan Housing Authority, Nationwide Children's Hospital, and CareSource. The program provided rental subsidies and housing stabilization services to Medicaid-eligible pregnant women who were nearly homeless or experiencing homelessness and at greater risk of infant mortality. Recognizing the importance of safe and stable housing in the effort to improve maternal and infant health outcomes in Ohio, Governor DeWine has recommended continued funding for the Healthy Beginnings at Home program in the executive budget. We have some distinguished panelists and speakers here today, and to introduce them and to take the program over, Ms. Shana Bryant.
Thank you, Senator Sykes. My name is Shana Bryant. I am the project manager for Healthy Beginnings at Home with Ohio. We would first and foremost like to thank the Children's Defense Fund for this opportunity and everyone for joining. And I will introduce up next Ohio's Executive Director, Amy Regal. Ohio is the cross-site lead for the Healthy Beginnings at Home Collaborative. And Amy has been a part of HBH since it was created. So with that, I will turn it over to Amy.
Thank you, Shana, and welcome everyone. It is a privilege to be able to speak with you today about the Healthy Beginnings at Home program. And so we'll just start out with a quick overview of who will be speaking today and what we'll be covering. And so this is an overview of not only Healthy Beginnings at Home, its past, present, and the future of what the program has accomplished and what we hope to still be able to bring to our communities. So next slide, please. We can go ahead and go one more. Thank you. So today I will do the overview of the program, and then we will have representatives from the different communities weigh in on why this program is important and the need that they're seeing in their community and how Healthy Beginnings at Home can help them to address infant mortality and housing stability within their communities. We'll also hear from Mara Klein from CareSource, who will be talking about the managed care and health partners that have been very valuable in this program and why this is a continued interest for them. So next slide, please. As I said, so Healthy Beginnings at Home is a program that has been in existence for over 5 years now. It's small. It started out as a very small micro pilot but over the years, it has grown. So next slide, please. And where it all started from was a question about the women who were entering a program in Columbus called Moms to Be. And it was a peer support and support program for women who were pregnant and helping them to have healthy pregnancies. And as they were talking to many of the moms, there was an underlying theme that kept coming up, and that was about the mom's housing stability. Many of the moms were talking about how unpredictable their housing was, how they were having trouble paying the rent, perhaps they were being kicked out of a home or experiencing other events in their lives that were making it uncertain for them of where they would sleep on any given night. And that was very stressful during their pregnancy. And as they then followed the women and their babies were born, and as they were bringing those babies home, even more stress was added as those women were experiencing housing instability. So it raised the question of, if the moms were able to know every night where they were able to sleep, if they knew they had a home to bring their baby to when that baby was born, they knew that they would have a place where they could set up the baby's crib and set up their changing tables and all those things that moms look forward to, would that help improve birth outcomes? So that was really the question that was launched to see how we could look at the connection between housing and birth outcomes. We also knew that as we looked at birth outcomes, that there was a racial disparity. And then with housing, we see that same racial disparity. So if we focused on targeting the areas with the highest disparities and targeting women who may be predetermined to experience these factors, could we also help improve the racial disparity in these cases? And so from that launched Healthy Beginnings at Home in 2018. It was an effort in Columbus looking at 100 women who were in a randomized controlled trial. 50 women received the intervention, 50 women were in the control group. And there was research done to look at the birth outcomes and the housing outcomes for their women. The neighborhoods that were targeted for recruitment of women were those with the highest infant mortality rates within Franklin County. And some women did come from outside of those zip codes, but the vast majority of the women resided in the zip codes with the highest levels of infant mortality at the time that they enrolled in the program. All of them were on Medicaid. All of them were in the first or second trimester of their pregnancy, and all of them were experiencing significant housing instability or literal homelessness at the time that they entered the program. This program was only sized to be a feasibility study. It was never meant to be statistically significant. What we were hoping that the program would show was, is there any type of trends? Are there any indications that this program should be taken to a larger group to try to determine statistical significance? And from that, it was determined that there were indications that housing was having an impact on birth outcomes, which led us to the present, where we're looking at how to scale this to a replication that would lead to statistical significance within the state of Ohio. And so this is a statewide replication with at least 4, possibly 5 communities participating in the replication. It will once again be rigorously evaluated. It will not be a randomized controlled trial this time, because there was noticed to be a significant difference between the control group and the intervention group. It was determined that a comparison data set would be more appropriate for this research moving forward. And it has now started with the first phase of a replication in both Columbus and Akron, who you'll hear from later. But what we're hoping is to secure the additional funding that would take us to enough women participating in the program to prove the effectiveness of this work this year through the state budget. And what do we hope comes from all of this? Do we hope that it's just a successful pilot? No. What we hope is that it's more than a successful pilot. That what this is research that would indicate the link between housing and health outcomes, and would set us up for there being formalized connections between the funding, resources, prioritization, monitoring of women during pregnancies so that they can receive the right types of supports and financial or other resources available to them to help them improve these birth outcomes. So this could look like different types of prioritizations within the homeless system for pregnant women. It could look like special allocations within Medicaid for pregnant women for housing supports and services. It could look like just communities talking together between different departments to link all of these efforts. So that is what we hope will move to really making differences in policies and in the way that programs are implemented related to housing and health for pregnant women. Next slide, please. So as we talk about that first initial randomized control trial, I mentioned that it showed some very promising trends, and these were just some of the results that we saw from that first phase. Of the 51 babies that were born in the intervention group, 40 of the babies, there was a set of twins, 40 of the babies were born full-term healthy birth weight. In comparison, only 24 of the 44 babies in the control group or the usual care group were born full-term healthy birth weight. There were no fetal losses in the intervention group. However, there were 4 fetal losses in the usual care group. And the most significant difference that we saw was when babies were born into either group. Sometimes they did have the need to utilize the neonatal intensive care unit or the NICU. And even though the intervention group was 60% less likely just to need the NICU services, if they did end up in the NICU, their length of stay was 75% shorter than the usual care group. Part of that was because mom knew in the intervention group that she had a place to go. The nurses knew that she had an apartment, she had a place to take the baby home to, that it was safe, that it was secure, that she knew how that rent was being paid, and that she could have the care come into her home and help her take care of her baby, that she could take the time to be with her baby during that period, and that there really was stability there. And so that served as a very important part of this program, and one thing that showed significant improvements for the women in the intervention group. Next slide, please. And what that translates into is savings to Medicaid. As I mentioned, all of the women were on Medicaid and most of them remained on Medicaid throughout the entire program. And so as we looked at the two groups, the cost savings between the intervention group and the control group was significant. And so if you look at this, the per member per month Medicaid spending for the women in the intervention group was only $351 in comparison to the control group, which was $646. And that wasn't just for mom, that wasn't just for baby, but that was for anyone else who was in the household with mom and baby. So not only were mom and baby seeing those health improvements, but the other children within the home, or if there was another adult within the home, they were also seeing those benefits. And so it really goes to show that the health impacts are not only to the mom or not only to the baby, but for everyone who experiences that housing stability. So next slide, please. So as we think about replication, we're taking this adventure that we had with one community, bringing together lots of partners around them, researchers, stakeholders, funders. There were many interested parties when we did the work in Columbus, and now we're going to scale this to 5 communities across the state. And so with that, once again, we have many researchers at the table, the Health Policy Institute of Ohio, Nationwide Children's Hospital, but other partners are looking at different elements of our work. We also have the communities themselves, which each have a lead organization, but each of those are wrapped around with many different partners from their communities that are at the table and really, helping to push this work forward. And then also on top of that, we have all of the managed care companies are at the table, and other health partners are also working in tandem. I currently am at the Coalition on Homelessness and Housing in Ohio. We serve as that lead entity. So our job is really to keep everybody singing from the same hymnal as we go throughout the next couple years, and really to make sure that all the research is to fidelity, and that each community is recognizing their own needs, but that the research remains standardized so that we can have this point of proof within our state. Next slide, please. And so with this, as I mentioned before, we have started the replication in Columbus and in Akron. And that was made possible by funding that was provided in the last biennial budget of $2.5 million, which is being administered by the Ohio Department of Health. And many state agencies have been great partners in this work, and we have been working very closely with them. And so through that, we've been able to start recruiting 30 households in Akron, 60 households in Columbus. That recruitment process is still underway. But it has started at this point. And as we look at the target population, it remains very similar to what we saw in the last phase of our research. It is a pregnant individual in their first or second trimester. They must be living in one of the study counties, so they can live in the greater area, but it has to be within the county. It does not have to be necessarily in the urban core, but within the county. They have to have a household income below 30% AMI. They must be enrolled in Ohio Medicaid managed care, and they have to once again qualify for either experiencing housing instability or homelessness at their time of enrollment. Next slide, please. And what we're really looking at is, do we improve the housing stability of the families? Do they remain stably housed throughout the entire program? Do we see improved birth outcomes? So once again, looking at that healthy birth weight and that full term pregnancy. What are the impacts on Medicaid spending throughout the program? Does the cost per person or per incident, such as time of birth, are they reduced by participating in the program? And are we able to impact racial disparities? Next slide, please. And all of this comes through a very comprehensive approach to our program. So it is not just looking at the pregnancy. It is not just looking at the housing, and it's not just looking at these isolated needs that the mom might have, but comprehensively looking at all of this together and seeing mom and baby as a whole person and their whole experience throughout this process, and how we can always be there to support them and help them through this journey that they are on. Next slide, please. And so as we look at this, the individuals are currently being enrolled in the program. And what the intervention is that they receive is rental subsidy. It is time limited, but it possibly could be ongoing. And they receive housing stabilization services. So that is a person who is really there to support them throughout this process. The women can participate in other programs. They may be a part of home visiting, WIC. They may be a part of the Pathways Hub. They may be a part of a Moms to Be group or other type of support group. There are many different things that we make the women aware of and that they can participate in. It is not required. The only required intervention is that rental subsidy and that they work with a housing stabilization specialist. They're made aware of all the other options and they can pick or choose what they would like to participate in. Next slide, please. And so the rental assistance is 15 months of full rental subsidy, and with the participant only paying 30% of their income for their unit. And then they have a 9-month step down program where the participant slowly takes over paying that rent in a gradual step down process where the housing stability specialist is still working with them throughout that process. However, some individuals from the very beginning or maybe throughout the process may secure a housing choice voucher or move into a subsidized unit. Those women are still supported by the housing support specialist throughout that journey. And when the program ends, they will still keep their housing choice voucher or be allowed to remain in the subsidized unit that they're living in. The women are encouraged, if necessary, or they're assisted in applying for those long-term subsidies as part of the program. Next slide, please. But the housing stabilization specialists, they're really key to all of this work. They are the ones who help the women find the unit, help them clear up any barriers they may have to finding housing, such as rental arrearages or utility arrearages, finding furniture for the home, paying a security deposit. They help them with that whole entire process. But what we also found is that when the woman is in the unit and she's settled in and she feels at home, she might run into some things throughout the time. She might have a dispute with her neighbor, or she might need to engage with the landlord to talk about a repair. She is going to come to the point where she has to renew that lease at the end of the first year for the next year. The housing stabilization specialist stays with them through that whole process, helping them to be able to maneuver those different events that come up, but also talks to them about enrolling in different programs, finding jobs, finding childcare, other things that they may need in their life to help them continue living in a holistic manner. So it is a really key part of the program. Next slide, please. So as what we look at the upcoming budget, we are looking to expand the replication to a total of 300 women. The researchers have determined that's the number of women necessary to reach statistical significance. So we're trying to bring this intervention to 300 women, and it is to pay the rent. It is to provide those housing support specialists. It also is to provide some things like some utility setups, pay off arrearages, things to help them move in, and to make sure that the research is done in the most rigorous evaluation process so that this can become an evidence-based practice in the long run if successful. And so the request in the budget is for $16 million in fiscal year 2024, and then an additional $1 million in 2025. That is currently in the budget through the new Department of Children and Youth. It will go to those 5 counties that I mentioned earlier, and it really will set the stage for this research that is necessary to take us to the next level. And so this ask, as you see, is very front-loaded in the first year. That is because that would be when most of the women would enroll. It would take care of those rental expenses throughout that time. And the additional $1 million really helps to fill out the research that is needed after the women have completed the program, as we continue to follow them to see what the persistence of this program is over not only the first year of life, but the second and into the third year of life, to look at that persistence, especially to Medicaid spending. So next slide, please. So now I'm going to turn it over to some of our great partners from our communities. This work really is rooted in community. And so they're going to tell you a little bit about the community need and their efforts in bringing this program to their counties. So we'll start with Maureen Stapleton from CelebrateOne.
Good afternoon, everyone, and thank you to the Ohio Legislative Children's Caucus for allowing us to come in and share with you what for Columbus is a shining star of what we've been able to accomplish with our partners. Columbus is, as you know, in the middle of the state, the largest city in the state, and is a growing city. We've known that for a number of years. And so housing and the contraction on housing is a big issue for us, and affordable housing is even more of an issue. With the number of folks who are coming to Columbus and have been for a number of years to relocate for jobs and opportunities, there was a need to look at this particular population because we have a housing crisis. But we also know that as the largest city in the state, we were challenged with some of the worst infant mortality numbers in the country. And so, as you know, as many of you may know, CelebrateOne was started in 2014 out of what was called the Greater Infant Mortality Task Force, Greater Columbus Infant Mortality Task Force. And out of those recommendations was, out of that task force recommendations was recommendation 8, which was to develop a backbone organization, a coordinating agency to address infant mortality. And so after the organization was stood up, CelebrateOne, and the first executive director was hired, it was really essential that we looked at all of the social determinants of health and determined where we were going to start first. And it was clear that housing made a difference, and housing needed to be the first thing that CelebrateOne and its partners tackled. And so we were blessed to have the partners that Amy has talked to you through, and we're able to find the success that she was able to share. I won't repeat what she said. We know that after the end of this program, with 100 women that were participating, we can get better birth outcomes for those who are housed in their early trimesters and given the opportunity to have supportive services. That's what we know. This opportunity for 2.0 is so exciting for us because it will then be statistically significant. And when it is statistically significant, that's a word I always have a hard time saying, we will then be able to impact policy in a way that we've never been able to do before. So for Columbus, it really was about understanding that infant mortality was a crisis in Central Ohio and in Franklin County. It was about ensuring that a community that we know is continuing to grow and not contract had affordable housing for some of the most vulnerable, and some of the most vulnerable are our families who are imminently or currently experiencing homelessness. And those that are pregnant, that you can't get any more dire than that, right? And so we have made significant investments under Mayor Ginther's leadership with governmental dollars, but we've also had a community that, and I can't speak enough about the philanthropic community of Franklin County and Central Ohio, that leaned in on this issue because they knew the fact that the reality that if we cannot develop systems to take care of our most vulnerable populations, there's not much you can say about a society, a city, or an area if you can't take care of those most vulnerable. And if you're talking about the most vulnerable, you're talking about babies, pregnant women who are homeless, and senior citizens. And so since CelebrateOne addresses infant mortality, that is where we put our stake in the ground. I'll end with this. From 2018, as we have been working with our partners to get to this 2.0 effort, we've been able to take the learnings from Healthy Beginnings at Home and begin to develop a system here that will live long past the research. And so I'm really, really excited to be a part of this 2.0 effort and thankful for our partners for leaning in with us.
Thank you, Maureen. And so we'll now hear from Shalita Smith from Akron, one of our new cohort partners who has launched in the replication.
Good afternoon, and thank you again for giving us the opportunity to showcase some of our findings, as well as just overarchingly why we decided to join in with some of our fantastic partners for healthy beginnings at home. I just want to pay homage to CelebrateOne for really helping us guide the path in terms of the infant mortality work in the Summit County area. We started doing some work around infant mortality with the Ohio Equity Institute back in 2014. But it really evolved a lot over the years with organizations such as CelebrateOne, Cradle Cincinnati, and even First Year Cleveland. So in 2017, there was a development of a collective impact collaborative in the Summit County area called Full-Term First Birthday, which is really spearheaded by the Summit County Public Health in the city of Akron. And through some efforts really driven from City Match as well as the Ohio Department of Health, we really started focusing on social determinants of health and what that overarchingly meant to our community. So through some data points that we received through the Ohio Equity Institute Neighborhood Navigators, we quickly realized from information starting in 2019 that approximately 60% of the women that we identified as pregnant through Summit County Public Health indicated some type of housing instability. 60% of our pregnant women indicated some type of housing instability. So that told us that we really needed to look into what was happening across our community and how it was directly impacting our young families and our pregnant individuals. So we started looking into the project back when it was 2.0 with CelebrateOne. We really started having conversations with CareSource very, very early on about getting the project in the Akron Summit County area, because we knew that it was going to be integral to impact the work that we were doing. We knew that we needed safe, affordable, stable housing for our families, and that the wraparound services around that were just going to be an additional asset to our families. A lot of times we unfortunately do have a decent amount of babies in our community that are dying because of unsafe sleep-related conditions. And a lot of that is environmental related. They don't feel safe in their home or the environment around them. It's not because of lack of items, baby items, resources, or education. So we knew that we needed to take that jump. So super excited to have the partnerships that we have. Our program is operated in conjunction with United Way Summit County. So they are very, very integral in this process, and they've really, really helped us lead the way. Since we've started the program, we've been able to get almost all of our women who's in the program currently housed. And what we've been seeing is once individuals are housed, they are able to focus on other things. We have one individual who's indicated that once she was housed, she was able to focus on her behavioral health. Prior to that, she felt like she couldn't do that because all she could think about was she didn't have a safe place to sleep because she was couch hopping or sometimes even staying in her car. We also recently had someone who just really reached out and outpoured her heart to one of our housing stabilization specialists, just indicating how grateful she was that she was involved in this program and she doesn't know where she would be without it. So super excited for those successes, because ultimately we're also engaging with wraparound services. We're making sure that there's supportive prenatal care. We have increased the availability for individuals to get just overall resources, because we do an overarching screening of all supportive services for maternal child health care in our community, which we're not sure if that would have been done before this program. So as far as expansion, we're just super excited to get the opportunity to increase the enrollment of our program. We know that this is a dire need in our community, especially for our Black individuals. We know and have been looking at the eviction rates as well as some of the landlords in terms of their opportunity to rent to this population and how they are just consistently overlooked. So just extremely excited and grateful for this opportunity to collaborate. I'm excited to bring on new partners as we move forward, and excited to see what the expansion does to the entire state of Ohio and how we can increase the overall birth outcomes of our moms.
Thank you, Shalita. And with the funding that we hope to secure through the budget process this year, we will be able to expand Healthy Beginnings at Home to 3 new communities. And one of those communities is Montgomery County. And so now I'll turn it over to Sarah Hockenbrock to talk to us about the work in Dayton.
Thank you, Amy, and thank you all of you. It is an honor to be with you today. My name is Sarah Hockenbrock, and I am the president and CEO of the Greater Dayton Area Hospital Association. And our organization serves the needs of hospitals and health systems in 11 counties across the Dayton region, including Montgomery County. One of our collaborative projects with our healthcare members are their individual and regional community health needs assessments and the community health improvement plans. And as a part of that work for a number of years, we have continued to see that one of our most significant challenges for Montgomery County is, in fact, maternal and infant health. And that is in spite of the fact that we have a number of programs and initiatives here within Montgomery County collaborating together to try and address the issue. And in fact, it is one of the cornerstone models for collective impact here in our community. And yet we are still struggling. From a hospital perspective, our hospitals have participated and supported a program here in our region called Help Me Grow Brighter Futures since the late 1990s. And that is our model in this region for using nurse home visitors for pregnant and new moms. And then we went forward with the expansion for the Pathways Community Hubs in 2020. And that allowed us to expand the model of community health worker support to moms and babies in our region. That particular model is very powerful and allows us to augment the work of nurse home visitors by increasing the number of community health workers, individuals with lived experience in our region. And the skill set of those individuals can really help with some of the social needs and the social determinant of health coordination, in addition to being a partner to walk with a mom on her journey for her clinical services. In 2022, 112 of pregnant women were enrolled in our Pathways Community Hub for pregnancy, and 85 of them identified as a member of a minority population. Unfortunately, only 4 of those clients were able to close housing pathways, mostly due to a shortage in options here in Dayton and Montgomery County. And while I know the challenges of housing supply and the cost for rental units is consistent across many communities in Ohio, housing needs are particularly critical and challenged with the Dayton region. After the Memorial Day tornadoes in 2019, we have found that we have lost more than 1,000 rental units here in this community in Montgomery County. So for our community, replication and expansion of Healthy Beginnings at Home provides our region with the ability to participate in research and then add a housing-focused layer of case management support into our existing resources for pregnant women and new moms. Again, we have to work together to link these resources and ensure the moms in our community receive the tailored assistance that they need, because the complicated situation here in our region is one that we know makes it even more difficult for women to navigate. From the perspective of our region's hospitals, the more comprehensive support that we can continue to provide every woman in every community in Ohio, we know that the children that come into this world will then be healthier, and they will then have the better chance to have a shared, similar, vibrant, and equitable opportunity as you and I do to succeed. We hope you will see the value in this model with Healthy Beginnings at Home and are incredibly grateful to Ohio for their ongoing efforts and leadership in this space. Thank you.
And lastly, I'll turn it over to Mara Klein with CareSource, which has been an important partner throughout all of the phases of Healthy Beginnings at Home. And we'll have her talk a little bit about their continued interest in this program.
Sure. Thanks, Amy. Good afternoon. My name is Mara Klein, and I'm the State Housing Strategy Lead for Ohio with CareSource. CareSource is committed to improving the health and life outcomes for all of our members. As we look across the communities we work with in Ohio, we're very aware of the health disparities that exist. We've been incredibly fortunate to work with the amazing partners who've spoken with you today to help in addressing these disparities and building healthier communities. CareSource believes that tackling social determinants of health barriers, such as housing, is key to improving overall health outcomes for our members. As you can imagine, it is impossible to truly stay healthy and manage things like diabetes or high blood pressure without a stable roof over your head. To do this, we must look beyond the clinical landscape and connect with our partners and with the community to create true and lasting change. CareSource has supported this effort since its inception, and we continue to be a strong partner in supporting expansion efforts because we know the benefits housing assistance can provide in boosting health outcomes. The CareSource Foundation has also provided ongoing philanthropic support for Healthy Beginnings at Home as it aligns with our company's mission to invest in initiatives and organizations that make a lasting difference in our members' lives and communities by improving their health and well-being. Health plans like CareSource will also benefit from expansion as we can focus on providing quality, cost-effective care to more Ohioans. Expanding Healthy Beginnings at Home throughout Ohio and beyond will provide opportunities for more at-risk pregnant people and their families access to safe, affordable housing and healthier outcomes. Thank you again for inviting us here today. It's been an honor to speak with you, and I'll turn it back to Amy.
Thank you. Next slide, please. So as we look at the needs from the communities and what we see with our partners, it is very clear that Healthy Beginnings at Home is needed within our communities, and that we are at a point in time where we see that there could be a way to help improve birth outcomes for women and children. And the time to act is now. And we have a great opportunity before us with the budget. And so we hope that you will work with us to support this effort so that we can commit ourselves to completing the research necessary to bring this program to every corner of the state of Ohio and to become a spotlight for a national conversation about health and housing and how we can improve birth outcomes. Many other states, the federal government, they're all looking to us right here in Ohio and to this research. So we thank you for your time today, and we look forward to your continued support.
Thank you very much. This time, we'll move to our question and answer session. It'll be moderated by my senior aide, Cole Calloway.
Thank you, Senator Sykes, and thank you for our panelists for joining. Thank you for your expertise and insight into this most critical issue. I will start off with our first, I'll start off by opening it up to the legislators and agency representatives to ask any questions that they have at this time.
I'd like to ask a question. Were there any concerns about experimenting with human subjects with the research that you're doing at all?
This research is done through an IRB process. So through the very rigorous process that researchers have to go through to use human subjects. In the first phase, I did mention that we used a randomized controlled trial, which did place 50 women in an intervention group and 50 women in a control group. It was because of the response that not only that we got from the women who participated in that first phase, but also the direct care workers who were a part of that first phase, knowing that there were outcome differences between the women who received the intervention. That was part of the reason that we chose not to use a randomized controlled trial and rather a comparison group moving forward in our research. And so, yes, we have worked very closely with those standards in this process.
Who is actually conducting the research? Are you partnering with the university or the Health Policy Institute, or who's doing it? Or are you doing it yourself?
No. We have many partners. Health Policy Institute of Ohio has been the lead. They submitted the original IRB for this program. Nationwide Children's Hospital, their research arm, has been a crucial partner in this effort. We have consultants who are working with us from across the nation who've done similar work to this to help us make sure that the model and that the research is conducted appropriately. And we're currently looking for other partners who may want to come in, because we know we do have great research institutes across the state. And so looking for other partners who may want to participate in our research program.
Thanks
Senator
very much.
Senator Sykes, in the very first iteration of Healthy Beginnings at Home, in addition to the entities that Amy mentioned, we also had the Biden School at the University of Delaware, Biden School of Public Policy, also participated in some aspect of the research.
Thanks, I appreciate it.
Any other questions from legislators or agency representatives? All right, I will move on to the question and answer portion. The first question we have is, who will manage the program in the Cincinnati area?
Shayna, do you want to take this one?
Sure, trying to unmute myself. That process is still in the works. We have been in contact with, oh my goodness, I'm having a black with, Amy, do you remember the name?
Cradle Cincinnati.
That's it. Thank you. I'm sorry. So we are working with Cradle Cincinnati as the lead, and they are working to bring other partners in locally on their end.
Very good. Our next question is, after this initial pilot stage ends, could ODM or Children Youth authorize continuation and expansion of this program to all counties, or would this have to be a legislative change?
There could be multiple paths of how we get there, but that is what we hope, is that this becomes a model for replication throughout every county within the state of Ohio, and that it would become kind of a part of Medicaid. And, you know, we would also hope that this would be viewed by federal organizations such as CMS of perhaps a federal demonstration that could be replicated in other states also. Mara, I don't know, do you want to weigh in a little bit more on the larger implications, hopefully, for this program?
I know that this is something that we've talked about in trying to pursue like tenancy supports through CMS. It's definitely something that, you know, we hope could be replicable in other states. We've got a program in Indiana, and as well as other, as CareSource looks at expanding into other states, wanting to make sure that it looks similar in other states as well.
Our next question in the chat is, could Mahoning and Cuyahoga counties be one of the counties considered?
So we are in conversations with first year Cleveland, and we're working to onboard, hopefully, a contingent from Cuyahoga County that will participate in the replication that would be funded through the dollars that are proposed in the budget this year. So Cuyahoga County is currently at the table. And then we would love, as I said, we would love to take this to every county within the state of Ohio. And we're hoping that this next phase will bring us to that point where we can talk about even more expansion of the program.
Very good. Next we have, and forgive me if I pronounced her last name wrong, but I just wanted to say this, Kelly Cupcake, I believe is how you say it. She said, "Thank you so much for sharing this incredible work. How can other communities participate in the HBH program to expand your reach? We in Southern Ohio are in dire need of the implementation of this program. Thank you."
So in this program, as we've mentioned, we're somewhat limited in the number of counties that we can currently expand to as part of the of this replication and research process. However, there are some things that you can do in your community to help this process. And part of that is through bringing together the groups that are necessary to have these cross conversations about health and housing. What we found is we set the table in each community. There's usually a health group over here, a housing group over here, maybe some case managers in the middle, but not necessarily a continuum of which they're having constant conversations with each other. And so setting that table, having the groups work together, having the homeless shelter talk about what the prioritization is for homeless women in the securing of housing, talking to housing providers about if there are elements of their tenant selection policy or of their rental policies that maybe exclude women with children from entering their housing or make it harder for women, and how your community can become more friendly to housing pregnant women and supporting women in these efforts. So there are some initiatives that you can start now. And we do have some great consultants who work with us, including Barb Poppy, who's on the call with us today, but not pictured here. And they can talk to you more, not only about what other communities are doing around the state of Ohio, but around the country of how you can start this work today in your community.
Very good, thank you. We have a question here. Can you speak to the intentionality of family dynamics and fatherhood as a component of care identified by the mother or pregnant person? They go on to say, "We do well with demonstrating fathers and marketing photos and healthy children, but work still seems to get funneled away from the family and pregnant person, child, to the mother baby family unit, which is, but do we intentionally support individuals without the caveat that everyone in the family receives cares, but to talk about how one overtly includes partner/father in the work and care?"
Yeah, so I'm going to turn this one over to Maureen and Shalita, but I want to say that one of the things that I really appreciated about the first phase was that the women were able to identify a significant other, a partner, or a support person who was able to reside with them, that there were not barriers to another adult living within the household and having that impede upon eligibility or other requirements. And so what we found is that the women did hold the lease, but however, other people were included in the household and were supported as part of the program. And so I think that's a critical part, is that how we help to keep family units together, whatever that version of family unit looks like, to help support everyone in the household to be as healthy and thriving as possible. So Maureen, do you want to talk a little bit more about what that looks like actually in practice?
So in practice, it takes a variety of avenues. That partner may not live in the household, but they need assistance as well. And there are a variety of programs that we can steer those fathers to for additional support, guidance, and direction. I wanted to make sure that question got answered, because it's so true that we often forget about the partner. And what Amy mentioned is absolutely critical. Many programs deter a partner from being in the household. This one absolutely allows that. And so we are trying to keep the family unit together and stable as a result of just that small policy change or programmatic change that will hopefully ultimately affect policy.
And
Thank
in Akron, Summit County, I would just like to say that we really encourage participants to engage or talk about other individuals that may not even be in the household but are a part of their village, that are assisting and taking care of their children, because there's a lot of different educational and resource components that are available from a social support sector that we're able to refer to. One in general is Safe Sleep, right? So just because an individual may not live in your house, they might watch over your child at some point in time, and they should be properly educated and given the necessary resources while in the primary care of your child. So when it comes to fatherhood, I think that overarchingly, we have some work to do in that space in making sure that fathers are included in the conversation. But I do think that we have a strong foundation here in terms of making sure that we are not negating anybody that is a part of the village of the participants that are coming in, as well as providing added value and resources to anyone that is the father or a father-like figure, whether they are in the home or outside the home. So super excited and grateful that we do have that whole family dynamic.
And an HSF in the program can refer back to CelebrateOne, a father who needs additional support. And so that's the linchpin. They don't get thrown to the wayside or forgotten, because there are other supportive services locally that we can connect with.
Very good. Thank you so much for that. We have a couple more here. How do we deal with the lead poisoning issues with rental housing and its impacts on infant and mortality and health outcomes?
Sorry, I couldn't get off of mute. So within this program, there are inspections of the households, and there is work with the landlords to try to not only within the question of lead safety, but other safety concerns or thresholds that we want to create within the households to make sure that the women are moving into safe and stable housing. Not just are we paying the rent, but we want to make sure that that is safe housing. And so that is an effort in the placement of the women into units that is taken into consideration. And we commend the work in many communities to increase lead safety of all units, because what we do know is that it can sometimes slow us down in placing women into housing and delay their ability to be stably housed, because we have trouble finding units that pass those inspections, or if there is a change that needs to be made in the unit, a landlord willing to make those modifications. And so that is a great impediment. And what we know is the longer it takes us to house a woman in the unit, the less likely they are to have that positive birth outcome. It increases the risk as they wait longer and longer for that housing unit. So having those units that are already having these regulations of lead safe, asbestos free, that are safe and secure is a great benefit to a community in this type of program.
Okay, I think that wraps it up in terms of the Q&A portion. I will turn it back over to Senator Sykes.
Thank you, Cole. We'd like to thank everyone for their participation today, particularly the presenters. Some very good information, the Children's Caucus and the Children's Defense Fund. As we all know, Ohio is facing a housing crisis, and is particularly impactful to low-income and homeless women who are pregnant. And the Healthy Beginnings at Home program is a research program started but initially as a focus group of 100 women, and it's proven that intervention can be very helpful. And they want to expand with the provision in the governor's budget. There's funds to expand the research so it can be statistically sound and impactful. And the intervention is basically providing a subsidy, a rent subsidy starting at 30%, and a housing stabilization specialist providing counseling. Those are the two main services that are being provided. And with that, it's made significant improvements in reducing homelessness and improved birth outcomes. So we're looking forward to additional information about this program and the research. We want to get the final research so we can move forward and plot a strategy to try to improve birth outcomes and reduce homelessness here in the state of Ohio. So thank you, everyone, for your participation. We went over a little, but we appreciate it. Thank you very much.